Global Healthcare Market 2025 to 2030, Expert Insights. Around the world, healthcare is not just an industry, it's a reflection of our society, economies, and priorities. Today, I'll walk you through global trends, risks, and opportunities shaping healthcare through 2030, and I'll share my perspective on what these numbers really mean for patients, providers, and investors. Part 1: The Global Healthcare Landscape. In 2025, global healthcare spending is already over $10 trillion, projected to reach $14 trillion by 2030. In my opinion, this growth reflects both an opportunity and a warning. On one hand, we see massive investment in life-saving technologies. On the other, rising costs threaten access for millions if governments don't act. Aging populations in the West, growing middle classes in Asia and Africa, and breakthroughs in biotech are all driving this surge. Personally, I believe that digital health and AI are the most transformative tools, but they need careful regulation and ethical oversight. Part 2: United States. Rising costs and innovation. United States. Medical costs in the US are growing faster than inflation, 4.2% vs 2.9%, and ACA premiums could rise 18% in 2026. From my perspective, this is alarming. High costs are not just numbers, they directly impact families struggling to afford care. Obesity drugs like Ozempic are revolutionizing treatment, but they also add pressure on insurance systems. I see this as a classic trade-off: innovation versus affordability. Policymakers must find the right balance. Medicare Advantage ratings and proposed home health cuts also create volatility. My view: providers and insurers need to proactively adapt, but these policies show how vulnerable the system is to sudden regulatory shifts. AI and health tech, attracting billions in funding, are a silver lining. In my opinion, those who integrate AI successfully will not only improve efficiency but also enhance patient outcomes, provided ethical standards and data privacy are maintained. Part 3: Europe. Aging and digital transformation. Flag. European Union. Europe is grappling with aging populations and rising costs. From my perspective, digital health and AI are essential, but workforce shortages and budget constraints limit impact. I believe that Europe's challenge is policy-driven. Smart resource allocation can unlock significant efficiencies, but only if governments act decisively. Part 4: Asia-Pacific, the fastest-growing frontier. Asia-Pacific is the fastest-growing healthcare region, with medical inflation up to 20% in Indonesia. In my view, this is both a challenge and a major opportunity. Urban areas are adopting private care and digital solutions rapidly, but rural populations risk being left behind. Insurers are experimenting with new pricing models and preventive care programs. I believe this is the smart approach. Investing in prevention today reduces costs tomorrow. From what I see, countries that combine technology, insurance expansion, and public health investment will outperform the rest. Part 5: Bangladesh. Local spotlight. Bangladesh's healthcare market is projected to grow from $14 billion to $23 billion by 2030. Pharmaceuticals and digital health are booming. Personally, I'm optimistic about these developments, but high out-of-pocket costs and outbreaks like dengue remain serious obstacles. My opinion: policymakers must accelerate insurance coverage and strengthen outbreak preparedness. Providers should focus on chronic care pathways and integrate digital solutions to improve efficiency and access. Part 6: Africa. Emerging opportunities. Africa is investing heavily in diagnostics, vaccines, and mobile health. From my perspective, this is the next frontier for growth. However, infrastructure and workforce gaps remain major barriers. I believe targeted investment and partnerships with private players can unlock enormous potential. Part 7: Global drivers and challenges. Globally, 4 forces are driving growth: aging populations, rising middle classes, digital health innovation, and pharmaceutical breakthroughs. But there are challenges: inflation, workforce shortages, and public health shocks. In my opinion, the biggest risk is inequity. Technology and investment must be coupled with policy that ensures access, or the gap between rich and poor will widen, globally. Part 8: Global forecast to 2030. By 2030, global healthcare spending could exceed $14 trillion. Asia-Pacific will lead growth, Africa and South Asia are emerging markets, and the US and Europe face affordability pressures. Personally, I see the biggest opportunities in integrating AI, telemedicine, and preventive care into scalable systems. The countries that do this will define the next decade. Part 9: Opportunities and recommendations. Here's my advice. Policymakers should expand insurance and invest in prevention. Investors should focus on pharma, diagnostics, and AI-driven health tech. Providers need to strengthen chronic care capacity and be prepared for epidemics. My personal takeaway: success in healthcare will come from combining innovation, smart policy, and ethical, patient-centered care. Healthcare is growing rapidly worldwide, full of opportunities but facing enormous challenges. How we respond, as governments, investors, providers, and citizens, will define healthcare for millions. That's my perspective, and I believe the next decade is crucial for shaping an equitable, innovative, and sustainable global healthcare system. Hand-waving. If you found this cinematic global healthcare roundup insightful, hit like, share, and subscribe. Stay informed, stay healthy, and I'll see you in the next video.